dispatched 30 minutes from the local hospital for a 36-year-old female at term 42 weeks gestation. Not her first baby, and with head crowning. He's on the bathroom floor and exposed. He knows the head right away. You know things are going to happen.
Seems like things always happen in the bathroom.
Yeah.
So we're going to start a timer. We're going to pinch baby. Baby comes out.
Baby comes out.
Baby up onto mom's chest. We'll get baby in a bag right away. And we'll try to get Pat on.
A limp baby right away with no cry yet.
No cry yet. Okay, we're just going to, can you continue stimulating baby? I'm just going to put this hat on baby. And we're just going to open airway. Do I see anything in the airway?
Still limp, no muscle tone, no cry.
Okay. Do you want to suction mouth then nose? I'm going to clamp and cut. We're not breathing or crying right now.
There were some secretions in the mouth that you were able to suction successfully.
Okay. So we're going to clamp cords. I notice we're at 43 seconds post-birth. We're going to clamp and cut. Scalpel sharp right here. So cord is cut. Okay. Let's take baby. We're going to move baby. Mom, baby's just not breathing real well. And we're going to come right over here. Continue stimulating. Can you get heart rate monitor on? How's my airway? Am I able to get my airway aligned? Tragus of the ear to sternum.
So with airway aligned, suctioning, still no breathing.
Okay, and I look in the airway now that I'm here. I don't see any secretions in the airway.
No.
My thermal mattress is activated, hopefully when I arrived. Okay, still no breathing. Okay, we're going to get our bag valve mask out, and we're going to put bag on. You're going to heart rate. And because we're apneic right now, I'm going to try it until we get the heart rate. So breathe, baby, breathe, baby, breathe, baby, breathe, baby. And then we just want to pull that taunt so I can see that chest rise. No oxygen. Breathe, baby, breathe, baby, breathe, baby. Can you get the SpO2 on the right hand, please? Breathe, baby, breathe, baby, breathe, baby, breathe, baby, breathe, baby, breathe, breathe, baby. Am I getting chest rise and fall as I am right now?
Yes, you are.
Breathe, baby, 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 breathe, baby. Come on, breathe, baby. Breathe, baby. Partner, can you come here? I want you to come and hold. Do you see how I'm pulling this jaw up nice and softly? So you put your hands just on the void. Breathe, baby. Breathe, baby. You take over there. Breathe, baby. What's my sat and heart rate? So just fingers along the jawline, not on the soft tissues. Okay. And pull the jaw up into the mask. Okay. And breathe, baby. You're going to ventilate as well. So, yep. Do I have chest rise and fall with my partner? Breathe. And you're going to go breathe, baby. Breathe, baby. Breathe, baby. Breathe. Just till you see chest rise. So we got an air leak right now. Sorry. Okay. Try again. Okay, we got chest rise and fall. What's our heart rate currently? 110. So heart rate is okay. We're above 100. What is our SpO2 currently? We're at 3 minutes at 65%. So we're below. So I'm going to turn on a couple of liters of oxygen. We'll go to 2 liters of oxygen. I'm going to take an oxygen and run through here. So I've got that set to 2 liters. I'm going to set a timer for me to remember to check this child in a minute. I think I'm going to be doing it. How's my SATs right now?
You notice them coming up. They're in the 70s right now.
They're in the 70s right now. Okay, we're 70, and we're currently 3 minutes in. So we're okay on the oxygen. 2 liters seems to be doing its job.
Heart rate's
I'm going to
110.
turn to my thing. Okay, we have no tone. We're currently not crying. We're warming. We have been stimulating. Do I have somebody that can rub baby? I guess we're bagging baby. That's probably enough stimulation. Cardiac monitor's on. We're monitoring heart rate. The next step, if we run into problems, is ventilation. So we're just going to have a look at Mr. Sopa. So if we need to, we can go to 2-person. If we're having problems, but we're getting adequate chest rise and fall. Can you see chest rise and fall every time?
Yep. Breathe, 2, 3. Breathe, 2, 3.
Okay, yeah, I do see good chest rise and fall. I'm going to grab my end-tidal CO2, and just so that he can monitor that a little bit more objectively. Pardon? My alarm went off? What is my heart rate and my SATs right now?
Heart rate's still 110. sats are, you notice, they are improving. They're up to, say, 75% now.
This one. What's my end-tidal CO2 come back at? You're like, I don't know. Let's say,
We'll say 60.
60? Okay, so we're getting good chest, well, 60 is a little bit high. So do we still feeling like we got good chest rise and fall currently?
Listen.
Yes. Thank you.
Breathe. Breathe.
Air entry, apices and bases.
So air entry is equal bilateral, and you're noticing symmetrical chest excursion with the BBM.
Okay. So we've got a mask. We got end-tidal CO2. We'll see where that progresses. I'm not sure what normal is after birth, but we'll just make sure that we don't have sudden changes, and at least we're getting end-tidal CO2 back, so that means we're ventilating.
You're
Adequate, and we're seeing adequate chest. Okay, slowly declining. We'll get that to end-tidal CO2 of 40 would go, but just breathe, baby, or 2-3 will work great. Okay, so we did suction mouth and nose. Airway, let's just throw an OPA in here. I think you're getting good, but let's just try putting that OPA in that child. Does that make it any better? No difference. Okay, OPA didn't hurt. We are getting chest rise and fall, so we don't need to increase our peak inspiratory pressure. We'll say we have a manometer here currently, and we're currently at 20 is getting chest rise and fall. And our advanced airway. So I'm just going to pull a tube and get a tube ready in case we have the tube for child. Our child is 42 weeks, so 3.5 endotracheal tube at about 9 or 9.5. So we got a 3.5 here. We got an endotracheal tube. What is my SAT and my heart rate currently?
Remind me of the time.
We're at 6:40, say 7 minutes.
Okay, so sats are 85%.
85%.
And heart rate's the same, 110.
85 at 7 minutes and 110. So we're still okay there. We worked through, we're ready for intubation if we need that. We got a blade. We got a
You are starting to notice some spontaneous breathing, but there's still a few in between.
Okay.
They are improving.
That's good. And SpO2 is still,
Yeah, what did I say, 85%?
yeah, 85. And our heart rate is above 100. We're ready for chest compressions.
No, it's 110.
110. Do I have another person here available to help if we need chest compressions? Where am I at? Let's call for some additional resources. I can call.
Okay.
So can we get some more resources?
Yeah, you're 30 minutes from the hospital.
Is there a bystander here that's?
I'm here, I'm the father.
Okay, I might. We'll see if we need to do chest compressions here in a moment. So we're ready for chest compressions. Next would be, we don't need to be on high flow oxygen, but if we need to, if heart rate goes below 100, if heart rate goes below 60, we're going to go to 100% oxygen. So we're ready for that. I don't think I need to prep epi at this point. Let's take a blood sugar and see what our blood pressure will go do our stable. What's our blood sugar?
So glucose comes back at 62.
Yeah, and how's my temperature? Are you doing a still at temperature? Sorry?
36.7.
36.7. Okay. So 36.7. And so that's good. Airway's good. We're breathing. Let's set a metronome for you.
And baby is beginning to breathe spontaneously.
Okay, well, I guess we don't need a metronome to keep time with breathing. Great job with the metronome. We'll, in a moment, just what's our SAT and our heart rate currently?
So 90% now, so it's improved. Heart rate's up to 150.
Okay, so it tells me that end-tidal CO2 is supposed to be 45 to 55. What are we currently at?
It's 50 right now.
Okay, and baby's starting to cry. Can we take the bag valve mask off? Is
Yes,
baby
you're
breathing
noticing
themselves?
improvement.
Okay, we'll just take that OPAH. Are they crying? What kind of respiratory rate are we seeing?
So as we approach 10 minutes, baby's breathing spontaneously. Sats are 95%. Heart rate's 150, 160. Respiratory rate 60.
60 and
And
good tone and
Not the best tone.
Not the best tone.
Improving.
but we're crying in here. I think that we'll wait for tone to improve. Once tone improves, we're breathing well. Heart rate is good. Our SpO2.
Moderate tone.
Yeah, let's watch our SpO2 and we'll just watch baby here for a moment. I want to get baby back to mom, but we'll watch our SpO2 now that we're on the room air and just see how we do. The tone and SpO2 continue okay, stabilized. After a couple of minutes, we'll move baby over to mom's chest and cover up to keep warm there. We're on a thermal mattress right now, so that's good. We've got airway breathing, blood pressure. What did you say the BP was? Remind me of that again.
64/34.
So that's adequate, and we have
Gives you a mass of
CO2.
42.
Okay, Mom, baby's breathing again. It gave us a bit of a scare there. It came out a little bit quieter than we would have liked, but baby's doing well now. We're just monitoring baby. Baby's, as you can hear, is crying well, and their oxygen levels is good, and their heart rate is good, and their skin color and muscle tone continues to improve. So if that continues, we're going to get baby back on your chest so you guys can bond a bit. Congratulations. It's been an exciting day for the both of us.
For the three of us.
It's like for the three of us. I guess for them, they won't remember it. So we'll we could get on the phone and discuss and say hi. We have a newborn neonate, 42 weeks, came out a bit flat. We needed to use positive pressure for about 5 minutes. And after 5 minutes, baby's now breathing 60 times per minute. End-tidal CO2 before we stopped bagging was at 50. And SATs are currently whatever they are. Heart rate is whatever it currently is. Am I missing anything? Do you have any recommendations? Baby's tone is still a little bit not great. I'd say moderate. So my plan is that if baby's tone improves, we're going to get baby over onto mom's chest, and we'll monitor heart rate and SpO2 and take off to hospital. You got any suggestions for anything I should do?